Hello and welcome back to another episode of All Things Diabetic. My name is Maureen Sullivan. I'm a registered nurse and a certified diabetic educator. Today's video, I want to focus on sick day management because truth be known, it's the first, quarter of September, and I was actually in Walmart today, and there was a line already of people to get their influenza or their flu vaccines for the upcoming season. So I think that the timeliness of this video is 2 thumbs up, yes. So what I wanted to focus on was some really basic information on preparing for sick day management, because the truth of the matter is that a lot of us are just at a higher risk of getting the flu or COVID or whatever the latest virus will be going around this upcoming season. And so the following recommendations are from the Centers for Disease Control and the American Diabetes Association on how to prepare just to give your best foot forward for the upcoming flu and virus season here. So what should you be doing now? And one of the most important things is to really stock up on the over-the-counter medicines that you may need at a later date. I personally trying to do a little bit every time that I shop, so I'm not faced with a triple-digit bill here all at one time, a little less sticker shock, if you will. But what the recommendations are for your over-the-counter medicines that you should have available in the event that you're not feeling well and you just don't have enough energy to get outside and go shop at that time is the following. You should have some over-the-counter pain relief medicine or pain medication. You should have some version of antacids. You should have a thermometer because this really doesn't work all that well. And you should have some type of medication for nausea and or vomiting. And that may be pill form, and it may be gel form, and it may be suppository form. So you know best what works with you. In terms of foods and drinks to have available, fruit juice and regular soda, and I'll explain why in a minute that the diabetic educator is telling you to get fruit juice and soda. Sports drinks, canned soups, instant cooked cereals. Think about what has a great shelf life at this point so you can pre-plan and stock up for, hopefully not necessarily the oncoming flu season here. So unsweetened applesauce, fruit juices, like I said, anything that has a shelf life that you're going to be able to work with and stock up now for, the upcoming flu season. The goal when you are sick, and we hope that you're not, this is just all pre-planning here, the goal is that you should be able to get 40 grams of carbohydrates every 4 hours. So you should be checking your glucose level more frequently, i.e. every 4 hours. You should also be in touch with your medical provider, your doctor, your clinic, whoever's following you, and let them know, hey, I may be needing further assistance down the line, meaning you may end up in the emergency room despite all your best efforts. So the guidelines for a trip to your doctor, to contact your physician, your medical provider, get to an urgent care or a local ER. If you are if you've lost over 5 pounds in 24 hours, 48 hours, that's something that even if you're intended to lose some weight, not the way to do it here. If your temperature is above 101 Fahrenheit, that's also a sign of some lingering infection that needs much more than supportive care, possibly some antibiotics. If your glucose level is dropping below 60, that's something that you really need to speak with your physician, your medical provider with. And if this nausea and or vomiting lasts for more than 4 to 6 hours, definitely that's some medical intervention. So like I said, the over-the-counter supplies, the stocking of your pantry now, those are really good preventative measures, but you need to be aware that if you're diabetic or you have some other chronic medical condition, now is the time to stock up, make sure you have adequate supplies. I know as much as we're going into the flu season and this viral attack on our system type season, we're also going in many parts of the world here into hurricane season and torrential tornado season. So prepare for the worst case scenario and kind of work backwards on that. But like I said, these are all just really good tips to share with your family and your friends on ways that we can be better prepared for the inevitable, which I hope never happens, okay? Like I said, if you are diabetic, now is the time to make sure, take some time and set aside all your supplies that you may need in the event of an emergency. And from an emergency standpoint, you should have at least 3 to 5 days of your medication available, your insulin supplies, your glucose testing strips, anything that you may need that you won't be able to get out and get. So, like I said, very simple tips and tricks here. The cdc.gov, the Diabetes Association is diabetes.org, O-R-G. Check out both those sites for more recommendations. But in the meantime, stay healthy, and if you can, consider getting in line at your local Walmart or your clinic or your doctor's office and ask for that flu shot. Okay, so for now, my name is Maureen Sullivan, an RN, registered diabetic educator, and just excited to be with you on your journey here. Look forward to your feedback and your comments. Let me know what you've done to prepare for the upcoming flu season. Have a great day. Thank you.